On the one side, and that's something that is addressed to us here, is for all the baby boomers and the adults. We have developed a brain training tool to improve, to enforce, to work out all mental skills in order to strengthen them and prevent being lost because of age. So the idea is to delay as much as possible the possible onset of a cognitive impairment due to aging. And when it happens, due to an Alzheimer's disease, Parkinson's, ictus, brain damage, whatever, we have developed a cognitive simulation program with the aim not to cure it, because nowadays there's no cure for that, but in order to slow down the deterioration progress, in order to delay as much as possible the threshold of dependence, so that people affected by a cognitive impairment can live longer with autonomy and independence from relatives, from social security, from social health, in order to maintain the quality of life for as long as possible. So how does it work? What we've done, we have developed a whole set of exercises, nowadays more than 30,000 different exercises, which are that work out all the mental skills, which are available in several languages and with different levels of difficulty, so that the caregivers or the relatives of people affected with these situations can build up what we call the stimulation plans that can be personalized to any specific need. So everybody, depending on his specific individual need, can have a specific working program to cope with his situation. Then the program shows that those exercises, they are done. The program automatically tracks the performance and the results, and according to those results, the program itself or the caregiver itself can change the difficulty, can change the activity, can change the exercise, whatever, the language, in order to create a continuous positive reinforcement circle that helps people get better and improve their situation. And we say that not for granted, because as a matter of fact, we have gathered several proofs of therapeutic efficacy, which means that people using the program really are in a better position than people who don't. And we have done that on the one side through several randomly controlled trials that show that for people suffering from Alzheimer's, Parkinson's, or even dementia caused by the treatment of AIDS are better off after time when they use the program. And those are trials that have been published in specialist journals. And on the other hand, and not with trials, but with testimonials from our customers, from our the users, the caregivers, the relatives of the people affected by the dementia situation, we have testimonials telling us that their relatives or the people affected by the situation are really improving in the situation thanks to the use of the program. And well, it's been a summarized presentation, and I'm open to answer to your questions or to your comments about what we've done and what's the idea behind it.
How long does an individual need to use the program before they see benefits?
According to the trials we've gone through, in about 6 months' time, they begin to show evidence of improving their situation thanks to the use of the program.
And how many exercises are they supposed to do?
It depends,
per day?
because as we are individuals, our mental, let's say, skill set is different depending on many factors: education, social environment, whatever. So when we begin to lose mental skills, what you are losing is different from what I'm losing. So that's the idea behind the program, that you can personalize the use of the program given that your situation is going to be different from mine, and the evolution of your situation is going to be different from mine, even if we do the same exercise. So the idea is that you can choose the exercise and the difficulty level of the exercise which is right to your specific situation, and you can change that over time, sooner or later, depending on how well you do, on how bad you do, or what the results that you accumulate across time.
Thank you.
You're welcome.
Is this something that you're billing for?
Billing?
Yes. Are you charging the patient?
Oh yes, it's a service. As a matter of fact, the idea is that people, it can be used online, software as a service, and then they pay a monthly fee. which depends on the amount of time they use the program. So that's a recurring revenue for us. Or you can license the program when you can install it on your computer. And then you pay a yearly fee depending on for how long you are going to install it, for 1 year, 2 years, or 4 years.
And does that cost just cover the access to it, or does it also involve, is there somebody on the other end monitoring this? Is there somebody somewhere else that's monitoring that, you know, the progress has stopped or you're not working in the right areas?
Well, the one who's monitoring the use of the program is the relative or the caregiver of the person who is behind the patient. And what we charge is for the use of the program that can be, let's say, prescribed by the caregiver or by a relative. But we ourselves are not the specialists behind the patient, because somebody, a neurologist, a gerontologist, whatever, is the person who has detected the program and who is behind the patient.
And can I ask, what is the typical monthly fee on average?
On average, they're paying something like €5, which is more or less $7, or between 25 to 30 euros per year if it's on a license basis.
Are clinicians prescribing this for patients, and are insurance companies, have you worked with them at all to get reimbursement for it?
Well, physicians are prescribing it for final users, and also residential homes and nursing homes are using it for people living on those places, and families who get to know the program either through their specialist or searching in the internet are using it by themselves at home. So far, insurance companies are paying for it not directly but indirectly.
And separate question, are you competing with companies like Luminosity, and how do you differentiate yourselves from them?
Well, we do. The main difference between Luminosity and ourselves is Luminosity is not on the therapeutic side of the business. They are more in the brain training side. And yes, we're competitors, although they are much bigger than we are.
Any comments, questions?
How did you develop the tools, the skills? Was that through coordination with doctors? And
oh yes, yes. We have a scientific advisor, which is Fundación ACE. It's a fundación which is based in Barcelona, which is headed by Dr. Mercè Boada. She's one of the, let's say, most well-known worldwide specialists in the field of cognitive stimulation, and she and her team work together with the people at the University of Pittsburgh. So our, let's say, medical directors or scientific advisors are these people.
thank you.
Do you have copyrights for any of this, for your methods?
Well, we try to patent it, but here in Spain you cannot patent software, not like in the States. But we have the intellectual property of the program. And then another way to, let's say, protect ourselves intellectually is it's a program, so it can be easily copied. So what we do is we add different layers of services and different layers of differentiative, let's say, items that overall build a competitive advantage from people just doing the program and not adding, for instance, the RCTs, or not adding the testimonials, or not adding the so big number of exercises, etc., etc.
You may mention with regards to your studies that the program works. Can you make mention with regards to the controls for the study? Were they performing no cognitive stimulation? Were they doing crossword puzzles? I mean, what was the control?
What was the control?
For the study?
Yeah, well, the studies typically are done in daycare centers where people with a very similar situation are attending them. So they, what they did there, they chose two groups, a control group and an experimental group, where the only difference between the two groups was the use of the program, in terms of average age, in terms of average years of taking some kind of drug for treating the situation, in terms of average socioeconomic background, whatever. They were the same background. The only difference was the use of the program.
But there was no other exposure to other methods of cognitive stimulation?
No.
to know, the patients are looking at it, or the providers, is there any alert, say if someone continues to decline in their progression in the program, that maybe they should go see a provider?
Yeah.
Or
Well,
something?
the program automatically tracks the use of the activities, the results, and the evolution. So the caregiver can check that anytime, and then given that information, which is rendered graphically or with or data on an Excel file, he can see if there is a decline. Say that, for instance, he can see that his user, for a specific activity, he started doing it at level 10, and then 1 week later he went to level 9, 8, 7, 6. So he's declining because the program itself changes the difficulty level when it detects that the user is doing it very well or is very bad. So if the automatic change of the difficulty is going down, that's an alert sign that something is happening here. And then it's the caregiver that looking at that then has to do something about it, like changing the program or realizing that that person is underperforming very much and something has to be done about it.
Okay. So when you physicians write for this or prescribe or I guess recommend, is there no feedback to that doctor who recommended it other than through the caregiver?
Well, the physician prescribing the use of the program is going to be the person who will be monitoring the use of the program afterwards. I mean, it's not ourselves. We provide the use of the program, but it is the physician prescribing it who will be overlooking the use of the program by the patient.
I was just thinking like our insulin, we have some, like I have some patients who are on insulin and they'll bring their like data card and we can plug it into our computer and it will show us the progress. I was kind of thinking more of the same thing, that if that patient came in, that physician could see kind of what their progress.
Actually, he does, because that information is available for him either online or because the relative of the patient bring the results with them.
Thank you very much.
You're welcome.
Now we're gonna welcome MedSet. So Maria. So MedSet is a software made of two parts. So one is called uClinic for physicians and uPatient for patients. And it facilitates the relation between physician and patients and for the follow-up.
Well, hi. Good evening, everyone. My name is Maria Serrano. I'm the project manager at MedSet. And tonight I'm going to present, as Anil said, our solution. I'm going to present you clinics and uPatient. These are we say, two sides of the same solution. So uClinics is for healthcare providers and uPatient is a software for patients. And these are, as I was saying, two interconnected platforms. What we do is we collaborate with key agents in the health sector, and together with them we develop the platform that enhances and enriches the monitoring process during consultation and also between consultation and consultation. So what we have nowadays in the health or health market and sector, we have all these like health information solutions and the EHR in consultation inside the medical centers, and we also have the rise of application. The number of applications and medical devices is increasing every day. But these two kind of solutions remain independent. So we found that there was a huge gap in between. There's a potential for all this monitoring data that's generated and gathered through the apps and applications, but this remains, but all this data remains kind of independent. It doesn't get to the